Gemma. I know Gemma's out there. Perfect. Awesome. Hi, Gemma. How are you?
Can you hear me okay?
Yes, I can hear you all right. Can you hear us all right?
Yes, absolutely.
Okay, perfect. Let's just wait a little bit. I think there's a little bit of connection. I'm not sure if it's on my side. All right, perfect, brilliant. I can see everything now. So welcome everybody to our first Instagram Live. It's myself, Sandrine from Injectset, and Gemma from Gemma Limassol. So why don't you just introduce yourself a little bit, Gemma, give a quick background to you, I'll give a quick background to me, and then we'll introduce why we actually decided to even talk about supplements.
Sure. Hello everyone, I'm Gemma, I'm Dr. Gemma. I am a medical doctor, I am an endocrinology and diabetes specialist. I have over a decade of experience, a bit all over the place, including Italy, South Korea, America, the US, specifically in London, and currently I am based in Cyprus, sunny Cyprus, and I did my PhD and research years in America, mostly on metabolism, insulin resistance, obesity, diabetes, human nutrition. So that's kind of me. And I am so excited to be here on Instagram Live with Dr. Sandrine, who is a dear, dear friend who I absolutely adore.
And I adore you too. Gemma and I worked in London, so that's where our paths collided, because I also have a bit of a background. My parents are from Mauritius. I grew up in South Africa, studied there, had my general practice there, found that I was not meeting the need of my older patients, and so I decided to do some more studying. Did my master's at King's College in gerontology or aging. Also worked in Ireland, and now working in London, specifically working in aesthetics, and obviously aging and menopause is a big thing that I deal with all the time. And so that brings us to why we decided to have this conversation, because Gemma and I chat to each other often, asking each other's opinion on different patients and that kind of thing. And medicine is obviously paramount to what we do, right, Gemma? Giving medication is important, but more and more the things that we're dealing with need lifestyle to be explained to our patients. So I don't know if you're finding that too, Gemma, that yes, we talk about medication, but lifestyle is so important.
Yes. And prevention, I think, like we shouldn't think of medicine as, once the problem arises, we act on it, but actually we should take active steps to prevent things from happening, to live a healthier and longer life, and that's so important.
100%, exactly. I see we've got quite a few people joining, so thanks so much. So we decided to do our first live on supplements, basically, because we're not sure about you guys, but we have been bombarded with lots of adverts for lots of supplements. And the thing is, the conditions that we deal with when we're consulting with our patients often require diet and sometimes supplements, depending on what blood results show. So we decided to pick our top 3 each, so you'll get 6 nutrients and vitamins, our take on those, and let's see where it goes to from there. Yes. Shall I kick it off?
Go for it.
So my number 1, and so you can tell me how it is in Greece, Gemma, but vitamin D is like non-negotiable for me here in the UK. I don't know if in Greece is also a big thing, obviously, because you mentioned sunny.
So, surprisingly enough, it is a very, very sunny country. There are very few days of non-sun in Cyprus, but despite that, actually the majority of the patients that I'm seeing are either vitamin D deficient or borderline. So I am still, advising vitamin D supplementation almost to all my patients, really.
Okay, that's interesting.
But I think in the modern world, like we don't have hours and hours of every day to spend just out in the sun. We just are all so busy, and obviously there's sunscreen and all sorts of other factors.
100%. I mean, here in the UK, I tell my patients, without a doubt, clock's changing, you're taking it because there is no sun. We don't even see the sun.
I remember.
Because it's like, I don't know, like 8 to 4. I mean, that's when we're in the office, right?
Yes.
So, what are the benefits of vitamin D and why you should take it? Okay, these are the big things. Skin, bone, mood, immune system. Those are like my top takeaways for everybody. So skin, vitamin D is an anti-inflammatory. We know from, like, because I do go on about this, aging is an inflammatory process. So if you're taking anti-inflammatory, like vitamin D, you're going to get that. It also is really good with cellular regeneration. Bone health, I mean, this is a huge thing for me. We can go into this in another discussion, but bone health is so important with women. We're at increased risk of getting osteoporosis as our estrogen decreases. So vitamin D is just honestly so important. Mood and mental health. So vitamin D deficiency, some of the signs are signs of depression and anxiety. Similar signs to things that people get with a decrease in estrogen. So literally taking that helps to stabilize your mood. Then immune system, obviously. And again, that period where we're not getting the sun, where we're not outdoors, is also the time when we tend to be a little bit more susceptible to getting infections. So vitamin D is going to help with that. So where do we get the vitamin D? Obviously, we've spoken about sun. It's the sunshine vitamin. I feel like my scrubs are like vitamin D scrubs. You can get it from food sources. So you can get it from food sources. Fatty fish, cod liver oil is not a bad one for vitamin D. Egg yolks, some fortified foods have vitamin D. But honestly, it's the sunshine, like being outside in some sun. So if you're in limited sunshine area or you're just not getting enough of it, then consider taking a vitamin D supplement. How much? I normally say around 400, max 800 international units a day, unless you're insufficient or deficient. Now, if you're diagnosed with insufficiency or deficiency, that's a blood test, right, Gemma?
Yes.
Like, your medical professional will be telling you that that's the case.
And
then
those
they will guide you
cases,
as to what dose you're supposed to take. Okay.
And in those cases, it can be 1,000 to 4,000 international units, depending on what you're starting off with.
Exactly, 100%. So, but your medical professional will guide you with that. Depending on what your blood results show, I will normally tell my patients what to take and how to take it. And often you'll need to take repeat vitamin D and calcium levels after you've taken very high doses, because we're mobilizing calcium into the blood vessels. So those are important things to know. When you're taking very high vitamin D, it should be with a medical professional and not just over the counter. And then how to take it, it's a fat soluble vitamin, so take it with a meal that's got some fats in it. Obviously consistency, you want to take vitamin D3, it's better absorbed into the body, and you want to take it with vitamin K2. The reason we want the K2 is because K2, so as I said before, vitamin D helps to mobilize calcium, right? And we want it to come into the bones, but vitamin K is the leader who tells the calcium where to go and tells it to go to the bones and not to the blood vessels. So we don't want to build up of calcium in our blood vessels. So that's why you ideally want to be taking it with vitamin K.
Can I add
something
on the vitamin D that's also important from an endocrine point of view? So it also helps regulate glucose and insulin levels. So for those that are suffering with insulin resistance, vitamin D gives you that extra boost and help. There have been some recent studies that have also shown benefits of vitamin D on gut health, which is also very interesting. So I would say, I mean, it's good for so many things.
Exactly.
Definitely.
100%. So do you want to kick us off with one of yours?
Yes. Can I just make a quick distinction, because you touched on this? So vitamins can be divided into water-soluble and fat-soluble vitamins. Now, why is this important? The water-soluble vitamins, when they are present in excess amounts, are not stored by the body for future use. So they are actually eliminated. And this is important because it means that every day we need to make sure that we get enough of it. That's why it's important, the distinction between water soluble and fat soluble. So the group that I will talk about is vitamin B complex. So this is made up of 8 different vitamin Bs, 1, 2, 3, 5, 6, 7, 9, and 12. Now, I'm not going to bore you by going into each and every one of them in detail, but they, as a complex, play a crucial role in our metabolism, specifically in converting nutrients into energy. Hence why sometimes they have this nickname of the energy vitamins, okay? But besides that role, they also play many other roles, such as an important role in cell signaling, DNA production and repair, in the production of red blood cells, white blood cells. It is important in amino acid metabolism. Now, amino acids are building blocks of protein.
Keyword.
You can imagine. Yes, of protein. And it also plays an important role in the production of hormones. So sometimes it's nicknamed the anti-stress vitamin, interestingly enough. And it also plays an important role in the production of neurotransmitters such as dopamine and serotonin. So also sometimes nicknamed the happy vitamins. So all these nicknames for the vitamin B complex, and they also play an important role in neurological and brain functions. So many important roles and functions. The foods that are rich in vitamin B complex are liver and other meats, poultry, seafood, eggs, dairy. Now, for those of you who are vegan and vegetarian, there are options that include avocado, shiitake mushrooms, leafy greens, legumes, and seeds. But if you are vegetarian or vegan, I'm not saying it is absolutely possible to get enough vitamin B complex from your diet, but you just need to pay a little bit of extra attention to the fact that you are getting enough of it, because vitamin B complex are water soluble. So we need to make sure that we get enough of it on a daily basis. And that's it for the vitamin B complex, I think. Do you have anything to add?
Yeah, I think the one thing is a lot of patients are on medication for gastric reflux. So like PPIs, and you tend to be deficient in vitamin B if you're taking one of those. So that's like omeprazole, and you like azole, and you've got like acid reflux, then just know that you most likely need to take a vitamin B supplement.
Yeah, absolutely.
So from the energy one, let's go into magnesium. What do you think?
Perfect.
So magnesium is one of my also top ones. The reason why I mentioned it after the energy one is that one of its top benefits is obviously sleep. We've got skin health. It helps with skin health. It helps with mood, bone health, muscle health, cardiovascular, digestive. I mean, yeah, it's a goodie. So skin health, again, it's an anti-inflammatory. So like vitamin D, it'll help with any kind of inflammation, which will be the early signs of aging. Sleep, it's amazing for sleep. A lot of my patients, especially in perimenopause and menopause, have this difficulty with sleep, and so it promotes relaxation, it regulates melatonin, helps with muscle relaxation, stress reduction, and improves sleep quality. Even my voice feels like it's become more smooth as I speak. Magnesium. It helps with mood regulation as well, so a goodie to take with vitamin D. Again, with bone health, so really, really important. Oh, muscle health, cramps, right? A lot of women, I think people in general sometimes will get muscle cramps sometimes after exercise. Women can sometimes get it with a decrease in estrogen, and so magnesium is great for that. Obviously, cardiovascular health, and then digestive health is really good with that. Okay, so now this is one of the things, right? I tell my patients, if you can get it in your diet, that's first prize, right? Because you want to be optimizing your diet, you want to be getting it through your diet. And so how do we get it? Leafy green vegetables, spinach and kale, they are amazing. So think dark green, Nuts and seeds, flax seeds, chia seeds, pumpkin seeds, you name the seed, it's probably got magnesium in it. Whole grains are also a goodie. Legumes, I mean, legumes are my favorite. I tell everybody to take them. There's, you know, like beans, lentils, chickpeas. I tell you, just put tins of them in your cupboard, right? You've got protein, you've got fiber. Honestly, just, there's no excuse. Just chuck a tin of them and you'll be like, you know, you'll have optimized meal. Some fish also have it, so your fatty fish, and then supplements. Okay, so now this is different to vitamin D, where we were talking about the dose you need to take, right? Because that's a dose we want to take to kind of supplement the lack of getting vitamin D. Magnesium we should get, you know, your recommended daily intake. So you want to be taking magnesium citrate. That's the most bioavailable form that we absorb and use well in the body. Glycinate is a little bit more gentle on the stomach, so if you have any digestive issues, maybe that's the option to take there. Magnesium chloride is the one that normally is the topical or Epsom salt, so you absorb it into your skin, so that's that one. And then you want to just take the recommended daily intake, you know, the RDI. I think men is around 300, women is around 750. Pregnant women and breastfeeding women is generally in the low 300s, a little bit more. So yeah, that's magnesium in a nutshell. It's a goodie.
So now that you've talked about a mineral, I will move on to a mineral myself. I will be talking about selenium. So it goes very much hand in hand, but selenium is a very important mineral. We only need small amounts of it, but it is absolutely fundamental in terms of the benefits it has, the benefits on our health. First of all, it is a very important antioxidant. So it protects our cells from damage, it boosts our immune system, and it has an anti-inflammatory effect. Now, from the point of view of an endocrinologist, there have been studies that have showed a positive effect on selenium on inflammatory diseases that affect your thyroid gland. For example, autoimmune Hashimoto's thyroiditis and Graves' disease. So there have been good, you know, scientific-based evidence on this subject. And it is also important for thyroid health for a different reason. Selenium is crucial to make selenoproteins, which are antioxidant / immune modulating proteins. And what do these selenoproteins do? They go and remove the free radicals that are produced during the making of thyroid hormones. So you can imagine it helps with thyroid health, and obviously that leads to optimal thyroid hormone production, which obviously, you know, affects lots of different aspects of our health, our overall, you know, well-being. So very, very important. Now, the recommended daily allowance of selenium is 55 micrograms. So that's very small amount. This amount is contained in about 3 grams of Brazilian nuts. Now, Brazilian nuts, why Brazilian nuts? Yes, they are rich in selenium, but not only, kind of thinking back to what you said, Brazilian nuts are also rich in zinc, in magnesium, in thiamine, in vitamin E, in phosphorus. So it ticks a lot of the boxes. So that's why I say Brazilian nuts. A thing to keep in mind though is that 55 to 70% of the selenium that we ingest is actually absorbed. So I always tell my patients, just have a bit of extra, like instead of 3 grams of, you know, Brazilian nuts, have 10 grams. Now, depending on the size of the Brazilian nuts, that might be like 2 to 4 Brazilian nuts, but I say approximately 10 grams. Yeah, and that is far, far away from the toxic amounts, which is actually 400 micrograms in a day. Okay, so that's good. Just in case Brazilian nuts is not an option for some people, other foods that are rich in selenium can be seafood, poultry, eggs, sunflower seeds, and whole wheat grain. So it's wonderful.
Yeah, that's really interesting. And yeah, I was going to say, I feel like a Brazil nut is like 10 grams, just like one. So
Exactly. So it depends on the size.
Thanks for all the messages, everyone, from Hannah, Dobronessa. It's a pleasure. Glad this is helpful. We're going to go on to the last nutrient. Oh no, second last nutrient. We've still got two more. Don't worry, everybody. It's not finishing yet. So omega-3. So for me, these are my trifecta, especially with women going into perimenopause and menopause. It's vitamin D, magnesium, omega-3. It's kind of like non-negotiable. You need to be taking these. Again, omega-3 can be taken in your diet. Okay, omega-3 is an anti-inflammatory. I mean, you're going to hear Jem and I throw this around all the time. It's so important with so many functions in our body. Obviously, from an aesthetic point of view and an aging point of view, it's for me very important in terms of that. So skin health, it's really great for skin elasticity, helps with hydration, that kind of thing. Obviously, anti-aging, as I've mentioned. It also helps with hormonal regulation, which is quite interesting. So a lot of people in menopause report that their mood swings and hot flushes can improve with omega-3. So that's really interesting. Kind of makes sense with the whole inflammatory marker, and estrogen is an anti-inflammatory hormone itself. So kind of makes sense that an anti-inflammatory nutrient would help with those kind of things.
It helps regulate, if I can.
Go. Yeah, tell us.
It helps regulate estrogen and progesterone. And it also, because of its antioxidant effects, basically what it does is it kind of keeps your hormones from degrading. So that's why it has that effect on hormones.
Well, exactly. So, like I said, this is why I'm definitely encourage all my women, but especially perimenopausal or menopausal women, to be looking at this. And then joint health, obviously a massive thing. It's really, really good in joint health and heart health. With the lack of estrogen or a decrease in estrogen, our hearts and our brains are massively at risk of disease. So the omega-3 is really, really good for both of those reasons too. So where do we get it? Fatty fish, that's your richest source, right? Salmon, mackerel, sardines, anchovies, I think would also class as that. So now this is important. So those fish have got EPA and DHA. So those are the types of omega-3 that are most easily absorbed in the body. Okay, and that's why those are the ones recommended. They are more expensive, so just bear that in mind. And obviously, like Gemma mentioned earlier, with any kind of vegetarian or vegan diets, you're not eating fatty fish. So you can get plant-based sources. So that would be flax seeds, chia seeds, remember them from the magnesium, and talk, they're also really good in fiber. So walnuts, soybeans, they have some, but now they have ALA. Okay, so they need to go through a conversion process before you get to the EPA and the DHA. Okay, so that means you generally may need to take more of it than you would with your fatty fish. Okay, then the American Heart Association, so they've kind of come up with like how much do you need to take. It's about 200 to 500 milligrams of the EPA and DHA. So that's normally around 2 servings during the week of fatty fish, all right? And then obviously, like I said, if you're taking it plant-based, so ALA, then you need to be taking a higher dose. Obviously, if you're taking it for any specific condition, inflammatory condition, etc., you may need higher doses, but that will always be with your medical professional. Don't do that on your own steam, all right? How to take it with meals. If you want to take it with also healthy fats. Split the doses if you are taking a high dose, but obviously that's going to be a discussion with your medical professional. Capsules versus liquids. Capsules often don't have that aftertaste, but liquids often you can kind of mix them up with like a milk, what do you call it, like a smoothie or whatever. So those are the ways to take omega-3. And on to you, Gemma. Anything extra with that?
Thank you so much. Like, those tips were amazing, brilliant. So moving on, my last is vitamin C. Now, vitamin C has been famous for years and years. So now I know that everyone kind of knows about its benefits. and role, it is a very potent antioxidant. Once again, antioxidant and anti-inflammatory is a recurrent theme in the things that we are suggesting, isn't it? So potent antioxidant, anti-inflammatory, it boosts our immune system. So definitely, it's also called ascorbic acid, vitamin C. It is one of the water soluble ones. So don't worry if you take enough of it, it will be eliminated, but it also does mean that your body doesn't store extra for rainy days. So we need to make sure we get enough of it on a daily basis. In the last few years, though, vitamin C has been receiving a lot of hype for the role it plays in collagen production. Now, there's been a lot of chat lately about, you have to take collagen and vitamin C together in order to really boost your skin collagen production. And maybe we'll get to that later. But yes, so vitamin C plays an important role in collagen production. It also means it has an important role in wound healing, in the growth and repairing of our body tissues. It also is important in keeping our bones, our cartilage, and our teeth healthy. It also helps us absorb the iron that's in our food. And a lesser known role that vitamin C has is on regulating cortisol and adrenaline levels. So it does have a slight effect on reducing stress and anxiety. So wonderful.
And when
wonderful.
you decrease those hormones, you affect those hormones, you affect all of the testosterone, the estrogen, because of that whole pathway.
Yeah.
Right?
Yeah, the whole perfect orchestra kind of is affected.
Exactly.
So it's very important. The recommended daily allowance for vitamin C is about 75 to 90 milligrams. Now, the foods that are rich in vitamin C, I'm sure everyone knows this, but citrus fruits, kiwi, strawberries, guava, mango, papaya, but also surprisingly enough, bell peppers and broccoli. So there are lots of different options available.
Okay, brilliant. Vitamin C is a big thing with skin, especially topical, like vitamin C serum and all of that. I don't know if we'll have enough time to go into collagen and that. I know it's a big question. And Jem and I have had discussions about this, and I think it probably warrants its own discussion in terms of collagen. Where is it at? What do we do? What do we take? We can maybe throw in protein and fiber in that life too. But yeah, that's basically it in terms of probably the most important nutrients, vitamins to think about taking. But I think the take-home message from both of us would be this: you can get it in your diet, right? Literally you can get it in your diet. And if you get it in your diet, you're probably going to hit your fiber kind of count, your protein count. So do you need to take supplements or not? I would say not, unless you have an insufficiency or deficiency, or you are lacking in getting that nutrient. I don't know what you think, Gemma.
Yes. Maybe vitamin D I would, just because of the statistics that show that most people are deficient of vitamin D. So I think vitamin D plus K might be one of those that I actually might opt for. Yes, please.
Yeah, I agree.
Rather than trying to get it through your healthy and balanced diet, obviously.
Exactly. I mean, what I would say is this, is that with the vitamin D example, is that you're not getting the sun, right? So, or you're using SPF, which is so important. That's like a whole nother discussion too. So vitamin D, you're not getting it, so take it, Same if you're vegan and I'm just not going to get this omega-3, maybe I need to take a supplement kind of thing. So that's exactly it, right? So if your medical professionals diagnose you with insufficiency or deficiency, they will guide you with what high dose you need to take. Do not take high dose supplements. You can have the opposite. You can have bad things happen to you.
You can get toxicity from vitamin or excess amounts of even minerals. So yes,
100%. Exactly. So this is the thing. So do not just take it because it's high dose equals better, because I think that's some marketing stuff going on there. And yeah, just chat to what you offer. You're welcome to DM one of us, right? We don't mind if you want to ask us about certain things. I see Lauren says lots of collagen and protein questions.
Yes, I just saw that. So we definitely need to do another session on other things that people are very interested in, like Lauren mentioned, collagen and protein. I think Paolo is asking, remind us of the 6 vitamins that we mentioned. So should we?
Yeah, go through it. You can do it. Yeah.
So it's selenium, it's magnesium, it's omega-3, it's vitamin C, vitamin D, possibly with K, and vitamin B complex.
Exactly. Perfect. So thanks so much for coming, Jim, and thank you everybody for coming.
Thank you, everyone.
And all the love. I loved all the little hearts.
Yeah.
And we'll do another one. We'll organize one, and we'll let you all know. And we'll do just to explain simply. If you have any specific questions, please let us know. Would you say people in Cyprus and people in the UK need different vitamins? I don't think so. Do you? I mean, Jenny, you've lived in both.
I think the debate was about vitamin D, but actually I have been seeing that there is a lot of vitamin D deficiency here too, the majority. So, I mean, there might be slight changes based on, you know, lifestyle, I think. Lifestyle and the produce that's available in the UK, here, what sort of diet. So everything definitely needs to be personalized and tailored, obviously.
100%, which is like what is just our vibe, right? We only do that. So that would be, so this is obviously general advice. Ask us questions. We're open to you asking us questions, and we will do another one, all right?
Yes, please reach out to us. Thank you so much for being online with us.
Yeah, thank you, everyone. Bye.
Bye.